Good day, my fellow colleagues, presenters, and listeners. My name is Mohammed Toro. I'm a postgraduate student from the Faculty of Robotics and um, Information Technology. The title of my paper, my brief presentation, is The Evolution of Artificial Intelligence in Medicine. Okay, background. We have to have an idea of what artificial intelligence is. Artificial intelligence in healthcare, most especially, is the term used to describe machine learning algorithms and software or AI to simulate human cognition in analyzing, presenting, and understanding complex medical data. Okay, introduction. Artificial intelligence has evolved over the past 5 decades with the advent of machine learning and deep learning. The use of artificial intelligence in medicine has expanded, creating opportunities for personalized medicine rather than medicine based only on algorithms. Some other factors that this artificial intelligence has touched parts are predictive models, which can be used to diagnose diseases, in forecasting and potentially preventive medicine in the future, improve the accuracy of diagnosis, improve the efficiency of the suppliers, workflow and clinical operations, facilitate better disease monitoring and therapy, and improve the accuracy of procedures and overall patient outcomes. Um, well, we have to, there is no, we will talk about artificial intelligence without looking back to talk briefly about the history and how it's all started. Well, the first problem-solving program was developed through research in the 1960s and 70s. Although it was created for applications in organic chemistry, it served as the basis for mycene system, which is considered one of the most important early applications of artificial intelligence in medicine. Mycin, which is also an early expert backchain system that used AI to identify bacteria that cause severe infections such as bacteremia, meningitis, and others. Other other common but not really recognized by practitioners systems Internist, One, and Castnet. This is a timeline of the development of AI, a trend in AI. We start in the 50s when the concept came in, first attempts in the 60s of computer-aided design in chest radiographs, 1980s concept of machine learning, 2000 machine learning in medicine, CAD in radiology and dermatology, 2010s deep learning, hybrid supervised, unsupervised learning. In the future, 2035, and people we are looking up to unsupervised learning and cognitive computing. These are innovations in medicine in the 1950s, 60s, 70s, 80s. In the 1950s, the artificial kidney X-ray image, um, electrocardiogram, pacemaker, cardiopulmonary bypass, technology of production antibiotics, defibrillator. In the 60s, we had the heart valve replacement, intraocular lens, ultrasound, vascular graft analysis, and blood processing. In the 70s, computed tomography, artificial hip and knee joint, balloon catheter, endoscopy, biological food processing, plant engineering. In the 80s, magnetic resonance image tomography, laser surgery, vascular graft, recombinant therapy. In present days, we have genomic sequencing and microarrays, position emission tomography, and image-led surgery. Well, the use of artificial intelligence in medicine. Usually, machines and computers are able to solve problem and learn, just like the human being. So, with this ability, the computer is made to understand natural language processing and translation, image recognition, visual perception, and it's able to make its own decision. Machine learning is one of the most exciting areas for developing computational approaches to automatic data comprehension. Branches of artificial intelligence. The AI in medicine has two main branches: the virtual branch, which the virtual branch, and the physical branch. The virtual component is represented by machine learning, also called deep learning, mathematical algorithms that improve learning through experience. There are three types of machine learning: unsupervised, controlled, and reinforcement learning. Then the physical learning, this involves using physical objects, medical devices, complex robots for medical care, robots for surgery. AI factors, growth in healthcare, increase in the future. What we tend to see is increase in individual healthcare costs, large geriatric population, imbalance between healthcare workers and patients, increasing global health spending, rise in unemployment, helping physicians to effectively solve their human tasks with minimal human intervention. Potential problems. With the use of AI, some of the problems we're going to face is one, development costs, integration issues, ethical issues, reluctance of practitioners to implement AI, fear of replacing people, privacy and data security, mobile medical applications and devices that use AI, lack of interaction between AI solutions, data exchange, state and federal regulation. The fast and interactive software update process typically used to improve existing products and services, rising unemployment, reluctance of practitioners to implement AI, difficulties in deployment. Okay, conclusions and future scenario of AI. Despite all the advantages and challenges, AI has more advantages, especially in diagnosis and treatment of patients. However, it has certain drawbacks, including unemployment. The future of AI includes cooperation between medical and technical institutions, removing clinical load firewall, integrating medical records, government funding, affordability, availability, enhanced data security, ease of research, new scientific and clinical results must be disseminated through open source. Integration and interoperability, including ethical, legal, and logistical challenges, are huge. Simplification, readability, and clinical utility of datasets. Thank you for listening. If you have any questions,